to invite Dr. Nimsing Ladip from Norfolk and Norwich University Hospitals to talk to us about advancing global hepatitis care through the use of a Hepatitis Care Companion app. Thank you.
Yeah, thank you very much, Chair and the audience for giving me the opportunity to present my work in collaboration with the team at Norfolk and Norwich and about advancing global hepatitis care, early insights from the Hepatitis Care Companion app. I'm a consultant hepatology working at Norfolk and Norwich. So this is going to be a summary of a multilingual offline first app with a linkage to care innovation. I do have some conflict of interest. The overview of what I will be talking about today will include how the project started and how it is at the moment. The project started, first of all, with raising awareness in a kind of information-guided pathway, and then to support adherence for patients who are taking these long-term medications for viral hepatitis, because there's a tendency for them to actually give up at some point, because most of these, particularly hepatitis B, there is no end date for most of the patients, except perhaps interferon. And then there was a shift at a point to ensure that we're targeting migrant users because they are the most affected population in regards to viral hepatitis treatment. And then also to bridge the gap for trusted sources of information, in particular because we know there are many social media handles teaching and promising unethical cures, and patients become vulnerable to these sources, and they actually take apps and so many things that would actually damage their livers more. Where we got to at the point of this presentation is that we have successfully been able to deliver an offline first multilingual app, which is on dual stores, meaning Android as well as iOS, backed with WHO guidelines, with reminders telling patients on when to take their medications if they forget. And then it keeps users in care because we've introduced a linkage to care model, which is actually one of the key factors where we lose patients to care, and with a provider dashboard that would support everyone in care. And so the unmet need, it is very clear. It's not in doubt that there is low awareness and late diagnosis when it comes to viral hepatitis. And that could underpin the reason why patients who come for the first time, they're diagnosed to have viral hepatitis when they have liver cancer. And so this is really, a challenge in some way. And then there's language and cultural barriers. In many cases, we recognize that because of migrant population, and sometimes these people do not engage with care very much, particularly because they're culturally not accessible to care. They do not actually come out. And also, the information available in regards to viral hepatitis has a lot to do with English-based information, and then this needs to be broken down in some way so that they can actually gain accessibility. There's evidence that if you get a patient to understand medical terminology in their language, they would properly engage with care. And there is definite poor adherence. We know there's data that 50% of people who have medications given to them across any chronic disease, they will abandon the medication. They don't take it regularly. And there's limited access to digital care tools, particularly in the realm of liver disease. And so this is very important that we lay this basis. So there are lots of unmet needs. And there's a gap in optimizing the knowledge of the care providers, GPs inclusive, and even some of our specialists, to actually arm them with information that would give benefits of the doubt, or to clarify to patients when they seek answers to their questions. And so this is how the project started and went. We defined the problem and then moved on to designing a concept and then prototype development, developed a pilot of it and then launched, and then we gathered the feedback midway and are expanding partnerships with the aim to be able to target everyone involved. At some point, we'd get on to policy scale-up. Right, so why does this matter? Well, data from the British Liver Trust has demonstrated a remarkable, significant increase in deaths due to liver disease, whereas deaths from other chronic conditions have been declining. This is not in doubt. Of course, although that data do demonstrate that most of the deaths are due to alcoholic liver disease, we do know that there's a contribution of viral hepatitis. But of course, that is UK-based data. But globally, we know that there's a big challenge in viral hepatitis care. Globally, we also know that there was this campaign about 90% of people do not know their status at all. And there's a campaign to go and find the millions. In our own data here in the UK, based on the UK Health Security Agency, we do know that about less than 21% of people who stay in care, particularly in refugee populations. And so there's a lot to do. And so the designing principles here was to get a human-centered kind of user interface with a language smart model and offline based, because we don't want an excuse about, okay, I don't have data to access information, and then it should be evidence aligned. And so we moved on to developing a minimal viable product, which was built across platforms using Flutter. Now Flutter is a system that would ensure that if you deploy an app, it would go onto both the iOS, that is Apple version, as well as Android. And so that was, we did that. And the presenter also worked on testing and ensuring that this was offline first and with some multilingual inclusion. And that was versioned, and several versions of it are placed on GitHub, which is an online system that would ensure continuity. In other words, if there was something that happens on the local court base, you could always get onto GitHub and deploy the one that is there. And so those were the things that I did. And together with my colleagues, we were able to now pilot this, first in the UK and Nigeria, particularly for obvious reasons. I have some background there, but also I was able to get a traction in some way. And that way, we got a lot of feedbacks and iterated a lot more. And we ensured that there was 100% usability, which was operational offline. User feedback loops were brought in, and which led to further iterations. And then we scaled this to global audience. And it's actually, I'll take you further to see what is there. And so this is actually the current appearance of the app. And it does look at the dashboard that has, of course, access to two interfaces, a patient user interface and then the provider interface. I would show you a little bit there, the patient interface there, which is a language switch section. And then there's a liver disease risk checker, where it's very simplified with images where patients can actually click, and then it would give them some idea about their risk of liver disease. And there's a medication reminder included that as well, hepatitis quizzes, and tests and reminders for scans and appointments. Then these are the real data that demonstrates what impact it has created. Now, this is a heat map that demonstrates where Hepatitis Care Companion app is currently being used. About 12,000 installs. Remember, this actually project started and actually gained traction mid last year. And so within a 1 year kind of assessment here, 12,000 installs over 90 countries. Of course, unsurprisingly, 96% use Android device. Majority are migrant and undeserved users, and that explains a lot. What users are tapping most the tutorials, because there are multilingual tutorials there. They would go in there, they can listen to it or they can read it. Medication reminders and the dashboard for HBV with knowledge quizzes. The average session is about 3 minutes. If you install the app organically, you are more likely to stay longer on it, which tells us that people are going into the Play Store to look for information in some way. And so retention, which is a measure of stickiness, in which case, how often do people install an app and go back to it? Many people install apps, and I guess many of us would say here, there are apps that you've actually installed many years ago you're not touching. But this one shows a little bit of difference. There's a 27.2% stickiness. Now, this is actually compared with the baseline of even health liver-related apps that has less than that. So that tells us a little bit more information. And unsurprisingly, the rating so far has remained at 5-star. And so there's organic acquisitions as well. We retain about more than 66% better than typical health apps, and users love it. And so, does this translate to behavior change? Well, this remains to be proven, but I believe that there's a model that demonstrates that if you pay attention to something, you are more likely to engage with it, and you could learn from it, and then it can lead to action. And so in some way, we have demonstrated 27% retention use, more than 4 times what health apps would show. So it does suggest that there may be some kind of traction with time to come. Well, I just quoted a single reviewer there, a learning tool for both professionals and the layman. The quiz is amazing. So what do we plan to do from here? Formalizing partnerships. I've actually had 2 already signing up, and we're hoping to get more partners who would actually go and do a lot more on this matter. Training and certification. By the first phase of next year, we hope to be able to integrate some certification systems there that would help educate carers, and task shifting tool for undeserved areas, regions of the world. And then we'll also aim to be able to support what GPs are doing within the UK system and elsewhere, with integrating some of this solution into GP systems in the London area in particular, embed WHO hepatitis toolkit, which is already being trialed in 1 center in Nigeria, where there is a linkage to care model. Clinicians enter a patient's detail, and then the patient would actually go in there and be able to see their information and their follow-up plans, and so on. And so I think that if we are to achieve the goal of eliminating hepatitis by 2030, which is a goal of WHO, 5 years from now, I'm not sure how we will do that, but digital solutions, particularly multilingual in nature, will help us to end hepatitis. If we can join forces, perhaps we might be able to get close to that goal. Thank you very much. And there's a landing page there for you to check.